Well, smartwatches are getting smarter than you think. Even knee replacement patients find that they can help with recovery.
An orthopedic knee specialist and founder of the Michigan Knee Institute is a pioneer in robotic knee replacement surgery and creator of the Elite Knee.
And Denise Erhart from Petoskey went through the procedure. She's here with us on the couch to talk a little bit more about it. Denise, welcome to you and good day.
Good morning.
So take me back before even the procedure. We were talking a little bit during weather. What was the first indication that you needed to have knee replacement surgery? That was the first alarm to go off.
Right. Yes, well, I'd had quite a few years of pain and had really put off the surgery, probably because of fear more than anything. But I'm a nurse and I worked in orthopedics, and maybe that gave me a little bit more fear. I don't know, but I was having more pain and unable to do the things that I really loved doing. And so I knew it was time. I needed to be able to ski and do the things that I love.
Yeah. So with this groundbreaking type of procedure, I mean, did that add to the fear of this is kind of an unknown, or was it more exciting to you?
It was more exciting, actually. And when I sat down with Dr. DeClaire to discuss my surgery and what he would do for me, he asked me if I would be part of this technology and this research program. And I was excited because as a nurse, I've been involved with research before, but never with technology involved. And so I was excited.
So it's a smartwatch study. How did it work? What was the technology that was employed in your knee replacement?
Yes, well, I was given the smartwatch to wear every day. And then they paired it with my iPhone and an app on my iPhone. And about a month prior to my surgery, they would give me information on that. I would get prompts on the iPhone, iWatch, and it would tell me I had tasks to do. And so I'd look at the app and it would be either educational that I needed to review, or it would be exercises. And throughout the day, there were 3 times a day you needed to do the exercises, and the iWatch would prompt me that it was time to do those.
Really cool.
And so it was really great. It was empowering to be part of your own physical therapy, and it made me accountable. And at the end of the day, after checking off all the boxes that I did my education and my exercises, it was really a sense of accomplishment. So I think it was a good motivator.
Yeah, that's a neat idea. I mean, there's nobody there telling you to do this, but there's something there telling you to do this,
exactly.
Right? So does that smartwatch, I mean, is that part of recovery as well then?
It is, yes. And so the exercises obviously continue post-op, and then for a year they followed me, and with what they could see from my iWatch that was going on as far as my step and my gait. And periodically they would say, I see your gait is not as good as it was. Is there something going on? And I could get back to them and say, no, I'm just, walking through a field and taking my time or whatever it was. But it was very interesting, and I'm really glad I did it.
Being in orthopedics, you've seen people go through similar recoveries.
Right.
What kind of difference do you think this program made in your recovery based on what you've seen in other people that have gone through the same process?
It was really amazing. I thought I had a good idea of what recovery would look like, but it was much quicker than I expected. I'm a very active person. My husband and I like to bike and hike and golf, and we're avid downhill skiers. And I was anxious to get out and do those things that I love. And within a few short weeks, I was able to get out there again. And that winter, a couple of months after surgery, I was out in Colorado skiing over 40 days without pain.
Wow.
And so it was awesome. I was so happy to be able to get out there again.
I was going to say 40 days skiing is a lot even on a good knee, right?
Yeah.
Did the smartwatch technology, did that change the need for actual one-on-one physical therapy? Did you still have that to go along with it?
I did continue to do a little bit after the smartwatch study, just because I wanted to get stronger and to be able to do my skiing especially, to keep that up and get to the level I wanted to. But I skied even more this year, and it was wonderful.
And you have so many resorts to choose from up here in northern Michigan, especially in the Petoskey area.
Yes.
And Denise, you touched a little bit on it, skiing, biking. Ultimately, what difference did you see when you had the knee replacement done, for people out there who are maybe feeling that pain in their knee and are maybe having the same fear or apprehension that you did about getting the procedure done?
Right. Well, I would say don't wait. I think I waited too long, and but in the end, it was fine. It didn't make it worse for me. It just prolonged my pain and the lack of enjoying my activities. So I would say, you know, if you've gone through other avenues and you're not getting relief, to definitely do it. It was well worth it, and I'm now, you know, doing my activities pain-free.
Was the surgery itself much different than what we would think of as traditional knee replacement surgery?
Well, one reason I chose to have Dr. DeClaire as my surgeon is that he is very innovative and uses a lot of technology in his practice, and he has developed specific techniques for surgery, and I know he can talk more about that than I can, but I was very impressed with him overall.
Well, good. And lastly, you did just touch on it a minute ago, but again, for those folks who maybe are feeling that nerve or that apprehension about going through it, you don't want them to wait, but just how did you get over that mental hurdle of saying, okay, fine, it's time?
Well, I guess it just gets to that point, you know, that you know you're getting older and you want to be the best you can be. And so I just encourage people to go for it and do it before it's too late and you can't enjoy the things you love. And I know from being a nurse that education and communication are especially important for the recovery of a patient. And I think this study proves that. It was very exciting.
Well, Denise, thank you so much for joining us this morning, giving us a little bit of insight into groundbreaking technology in the medical field, and cheers to another summer full of biking and another winter full of skiing for you.
Yes, thank you very much.
Yeah, that's exciting. Denise, thanks. We're going to share some of the information about Denise's surgery on 9and10news.com. Thanks again.